Hello, and welcome to my office. My name is Dr. Susan Marra, and I'm a naturopathic physician here in Seattle, and I specialize in tick-borne illness. Today I'd like to talk to you about the correlations between Lyme disease and autoimmune diseases. Lyme disease, as we've previously discussed, is an infectious disease that is caused by the bacteria known as Borrelia burgdorferi. We frequently see various types of autoimmune disease in people with chronic Lyme disease, and by the word chronic I mean somebody who's been infected for longer than 12 months. We frequently see various presentations of autoimmune disease such as Hashimoto's thyroiditis, lupus, multiple sclerosis, Sjogren's disease, Graves' disease, and rheumatoid arthritis. And what's interesting is the correlation between these autoimmune diseases and the presence of an infectious agent, specifically Borrelia. The reason that I think this is so interesting is I believe that what is going on is somewhat of an epigenetic phenomenon. In other words, a patient may have a hereditary propensity for rheumatoid arthritis in their family history, or lupus, or Sjogren's, and then they get infected with Borrelia, and the Borrelia bacteria actually alter the phenotypic genetic expression, which results in an autoimmune condition. Now, we know, for example, that foods can alter your genetic expression. In other words, wheat. We know that wheat in certain people gives rise to celiac disease, especially when they have the genetic propensity. But even if they don't have the genetic propensity, they can develop symptomatology of wheat allergy and what looks like celiac disease. I believe what's going on is that there has been destruction by the infectious agent to the mucosal membrane in the gut as a result of the presence of Borrelia and wheat, and this causes severe chronic inflammation that sets the stage for what's called a leaky gut. A leaky gut is when molecules, food molecules for example, cross the mucosal barrier and enter the bloodstream and travel in the bloodstream to various parts of the body, including the brain. If the mucosal barrier in the gut is leaky, it's quite likely that the blood-brain barrier is leaky as well. And therefore, molecules that shouldn't be entering the brain, such as the gluten molecule, enters the brain and causes significant neuroinflammation. We know that there is a high correlation between wheat allergy and many different neurological diseases, such as autism, Asperger's disease, and any of the disorders not on the spectrum. We also know that wheat is not a food that is necessarily all that beneficial for either the gut or the brain. And I think that you couple that with the presence of an infectious disease like Borrelia, and you've got a double whammy, and you've got significant barrier demise, such that molecules that aren't supposed to be entering the bloodstream and the brain do so, and cause significant and chronic inflammation. So I hope this brief video has helped you understand autoimmune disease and Lyme disease. And I look forward to speaking with you on further topics regarding Lyme disease. Thank you so much.